Hello friends, in this video we will talk about the physiology of high altitude and deep sea diving. We will talk about scuba. So scuba is nothing but self-contained underwater breathing apparatus. So we can see in the diagram, we have the air cylinders here and there is a first stage valve which is there. We have an inspiratory valve and an expiratory valve. Inspiratory valve is for the release of the gases from the air cylinder. Expiratory valve is to release it to the sea bank. Okay. So whatever the gases which are already inspired will not be expired again. It will go into the sea. And this is the hose pipe. This is a hose pipe connected to the mask. This is a mask and a demand valve. So what we just do is that when this apparatus starts, some amount of air from the air cylinder will be reaching the first stage valve. From the first stage valve, it will go into the hose pipe, and from the hose pipe, it will go into the demand valve where the oxygen supply is required, and that is how the person who is wearing the mask and going for deep sea diving gets the oxygen. And some important points, we have the breathing mixture not flowing continuously in the mask, okay, and there is also a negative pressure, negative intrapleural pressure that pulls the diaphragm to open. See, if there is positive pressure, the lungs will collapse and we will not be alive now. Alright, and yes, and it reduces the first stage valve. As I was saying, it is reducing the pressure from the tanks. So the air delivered to the mask will have a pressure with a little pressure difference will be there. Right. And we will take in this scuba only amount of air we need to inhale. That's briefly the mechanism. And coming to the disorders, we have acute oxygen toxicity, nitrogen narcosis, high pressure narcotic syndrome, decompression sickness and scuba. So acute oxygen toxicity, we have the inhalation of 100% oxygen causing the acute oxygen toxicity. And CNS effects are caused, which we will see. So oxygen will be reduced to 20% so that it is prevented. Now coming to high pressure narcotic syndrome, we have the narcotic effects of nitrogen at deeper regions where we have the helium and oxygen mixture. Why helium is preferred? Because narcotic effects are very less. It is a noble gas or inert gas. It doesn't react much, helium, and very lighter. Density is 1/7 the nitrogen. So air resistance will be very less. But if we take nitrogen, it is slightly more. But due to anesthetic effects of helium, it causes tremors, drowsy and incoordination. Now, another mechanism. We have the oxygen breathing at 4 atmosphere pressure. That is some 3 to 4 atmospheres or 30 to 40 I can say. It leads to brain seizures or coma. Coma within 30 to 60 seconds and free radicals will be involved where the metabolisms will be impaired. Now coming to hyperbaric oxygen therapy, oxygen is administered at PO2 of 2 to 3 atmospheres through the mask. Now coming to main thing, the main goal of this competency along with the scuba is decompression sickness. So main important, please remember only decompression sickness. Now there is a slight, so suddenly the barometric pressure comes down when we come from deep sea to the sea level. And when we ascend, what happens? The lipid solubility that time is 80%. So it leads to the nitrogen bubbles and this will block the arteries and veins supplying the tissues. Now these are the symptoms to show. We have the CNS, the pulmonary and the coronary blood flow. CNS, it causes dizziness, paralysis, unconsciousness, collapse because of positive pressure in the lungs. And pulmonary blood flow, pulmonary blood flow, we have SOB, severe pulmonary edema, rupture of pulmonary veins, that is called air embolism, and coronary blood vessel. Coronary artery supplies what? Please remember this first. Coronary artery supplies heart. In heart only myocardial ischemia. Myocardial ischemia, that is nothing but reduced blood flow to the cardiac muscle. So that's what happens in coronary blood vessel. Lastly, we have the prevention and treatment. Prevention can be by slow decompression, and the treatment can be the tank decompression and the hyperbaric oxygen therapy. So that brings us to end of the video. So thank you so much. I'll see you in the next video.